Now for this next episode, we are going to look at data in the form of a table rather than a chart. This is to compare how different the medical industry is under a freer market versus one with a lot of government involvement and health insurance. So cosmetic procedures are not covered by insurance because they are not related to ailments or injuries, etc., for the most part, whereas other medical procedures are related to ailments and injuries. Kidney stones and brain surgery and broken bones and just doctor checkups and things like that are all part of what is covered by medical insurance, and therefore it seems low cost to the consumer when in fact it's much more expensive, as we're about to see. So in 1998, these were the prices in 1998 dollars for all of these various cosmetic surgery procedures. And remember, there are two broad categories of cosmetic surgery procedures. Some are done by very attractive people to become even more attractive, category one. And then the second category, where someone who is rather ugly or has a deformity is getting their deformity corrected to become less ugly. And there is a valid marketplace for both of those. But customers for some of these procedures are never customers for other procedures. So both of those categories of cosmetic surgery have a valid marketplace. And this is the number of procedures done in 1998. Then we move 23 years ahead to 2021, and the price of the same procedure in 2021 dollars, and then we have the number of procedures done in 2021, and then the price percentage change. And you can see some prices even went down in absolute dollars. And in these cases, the volume of the procedure went up a lot. Things like Botox injection went from just 157,000 to 3.6 million. Now this, of course, is something that is done more than once. It is done with some regularity among the frequent users of Botox. But then there are other procedures that are only done once. And nonetheless, as technology improves some of them at varying speeds or not, and based on cultural trends, some of these happen to be done far more often. And you can see all of this data over here. In grand total, there are about 3 times as many. 2,067,000 versus 6.133 million. And now the important part, the average cosmetic surgery price increase, both unweighted and weighted, we should take weighted, is only 38.2% in this free market where all of these are voluntary procedures and there's no insurance or anything. So the providers have to compete on price and quality. And the CPI of all items, everything from food, energy, healthcare, college tuition, electronics, other consumer goods, etc., was 66.2% over the same period. But we see here that the CPI for medical care services rose 132.2%, and for hospital services, where insurance distorts the marketplace the most, it rose 230.4%. And if these two had not risen so much, even this 66.2% would be considerably lower because healthcare costs are a major component of all inflation that has occurred. And the absolute amount of inflation that has occurred is still not high. This is about 2.5% a year, given that it rose 66.2% over 23 years. But the fact that the free market medical procedures rose at a rate lower than the broader inflation rate and much lower than hospital services and medical care services, where you have insurance and government involvement, and some people have the illusion that it's free, but then the costs paid by the system are much more, is very, very stark over here. And remember, these cosmetic procedures are voluntary, so there's more pricing pressure. It's richer people that are going to do it. Some very wealthy people would pay more than these prices if they really want something, yet the competitive nature of the marketplace and the volume of procedures has made it such that the price has often gone down, or at a minimum has not risen by very much. Laser hair removal, that has fallen by minus 63.1%, and therefore this is done at much greater frequency than before, as opposed to hospital services, 230.4%. So this is something to think about in terms of government involvement in an industry or a marketplace, and whether that actually drives down costs or it increases costs because the end user isn't paying, so they don't care about how much graft is in the system. A very similar situation has occurred in education. The costs of formal colleges versus online free educational material that people can use, as an example. The last few pockets of inflation are governed by industries where there is extensive government involvement for the supposed purpose of reducing prices rather than increasing prices. Think about that. Thanks for watching.